There's a new point person at the San Luis Obispo County Jail for all inmate medical issues. The role of Chief Medical Officer comes at a time of turmoil at the facility following the death of inmate Andrew Holland and questions surrounding how inmates are being treated. I sat down with Dr. Christy Mulcairn for her first TV interview. We discussed the work cut out for her. The images are disturbing and unforgettable. Seeing inmate Andrew Holland strapped to a restraint chair for what would be 46 hours as he awaited a transfer to mental health and what would lead to his death. Dr. Christy Mulcairn says it's hard to say whether her new role at the jail could have saved Holland's life, but she knows today the situation would be handled differently.
Our communication has improved so much that we would be able to call the psychiatric health facility and be able to do a good job explaining why he might need to go over there more acutely.
Her position of Chief Medical Officer was created by Sheriff Ian Parkinson, part of sweeping changes made at the jail since Holland's death. Mulcairn now oversees all inmate health care. She says the biggest challenges she faces are two-pronged: chronic, untreated medical issues and getting inmates the proper treatment.
We see a lot of heart disease, diabetes, complications from hepatitis, complications from alcoholism, and long-standing drug use.
And the sheer volume of inmates coming in with mental health problems. Holland, who was diagnosed with schizophrenia, being one of them.
A close second to that is when the patients don't want to take their medication.
Mulcairn will go before the Board of Supervisors this week and ask that they declare the jail a treatment facility, which will allow them to force medicate inmates incompetent to stand trial.
We'll be able to have that patient take their medication and start to get better while they're waiting for the state hospital bed.
Holland's death has also called into question the inmate death rate at SLO County Jail. From 2010 to 2014, the last publicly available state statistics, there were 5 deaths, 0 in 2010, 11, and 13. 2 deaths in 2012 and 3 in 2014. Now compare it to the state numbers. When adjusted for population, SLO County was about double the state average in 2012 and nearly 3 times in 2014. In your medical opinion, do you think those are high rates?
It's really important to look at the number and not the rate. So what happens when you have 2 versus 3 is that 2 could be the national average and 3 could be double the rate, double the national average.
But Mulcairn adds, people are not statistics.
My goal is to make sure that these inmates are getting the very best care that they can get.
And she makes no qualms about the task ahead. Now, during that 2010 to 2014 time period, Santa Barbara County Jail also had 5 inmate deaths. For their population, they were either at or below the state average. Now, before her role as Chief Medical Officer, Dr. Mulcairn was hired as a SLO County Deputy Health Director in 2016. And before that, she was a pediatrician in Santa Clara County for 4.5 years. Her salary is $216,000 a year.